March 14th, 2026. A kitchen in the early morning. A 67-year-old man fills a glass with water before putting on his shoes. His legs have felt heavy on several mornings, and today he starts with one simple habit before breakfast. The drink is plain water, and the reason it matters is more basic than most circulation claims suggest. As people get older, staying adequately hydrated can support normal blood volume and help the cardiovascular system function properly, although no drink can instantly clear blocked arteries or guarantee faster blood flow through the legs. The first glass of the morning is not a treatment for poor circulation. It is one small part of maintaining the conditions the body needs to circulate blood normally. During sleep, several hours can pass without drinking anything. The body continues losing water through breathing, sweating, and normal urination. By morning, that can leave some people mildly dehydrated. The effect may be more noticeable in older adults because thirst can become less reliable with age. Some medications can also increase fluid loss, while certain medical conditions require people to limit how much fluid they drink. This is why the right amount of water is personal, rather than a universal number. A glass of water in the morning can replace some of the fluid lost overnight. Within the body, water becomes part of the fluid that carries blood cells, nutrients, hormones, and waste products through the circulation. Blood itself contains a large amount of water. When the body is adequately hydrated, the heart and blood vessels can continue performing their normal jobs without the added challenge of significant dehydration. But there is an important distinction. Drinking water does not physically open a narrowed artery. It does not dissolve a blood clot. It does not reverse peripheral artery disease. And it does not produce a guaranteed circulation boost in 5 minutes. Those claims sound attractive, but leg circulation is controlled by a complicated system involving the heart, arteries, veins, muscles, nerves, blood pressure, blood sugar, and overall vascular health. For someone over 60, that distinction matters, because persistent circulation problems should not be treated as a hydration problem alone. Peripheral artery disease, commonly called PAD, can reduce blood flow to the legs, because arteries become narrowed or blocked. One common symptom is pain or cramping in the calf, thigh, or hip during walking that improves after resting. Other signs can include cold feet, changes in skin color, slow healing sores, numbness, or weaker pulses in the feet. Those symptoms deserve medical attention. A morning drink can be part of a healthy routine, but it should never replace an evaluation when symptoms suggest a vascular problem. The simplest version of the morning routine is plain water. Start with a glass that is comfortable to drink rather than forcing down a large amount at once. Drink it slowly. Then continue drinking according to your body's needs and any instructions from your healthcare professional. For many healthy adults, water is the easiest choice because it provides hydration without adding sugar, excessive calories, or unnecessary stimulants. There is also no special ingredient that needs to be added for water to work as water. This is where many online circulation claims become confusing. Lemon water is often promoted as a circulation drink. Ginger water is described as a natural blood thinner. Beet juice is frequently presented as a way to open blood vessels. Coconut water is marketed as an electrolyte solution. Some of these foods and drinks contain nutrients or compounds that have been studied for cardiovascular effects, but evidence from individual studies does not mean that a particular drink will rapidly improve circulation in every older adult. Beetroot is a useful example. Beets contain dietary nitrates, which the body can convert into nitric oxide-related compounds involved in blood vessel function. Research has investigated dietary nitrate and blood pressure, and some studies have found beneficial effects. But drinking beet juice is not the same as treating blocked leg arteries. A person with PAD should not assume that beet juice can replace medical care, prescribed medication, exercise therapy, or other treatment. The same caution applies to ginger. Ginger contains biologically active compounds, and research has examined its effects in several areas of health. But it should not be described as a fast treatment for poor leg circulation. People taking blood-thinning or antiplatelet medicines should also discuss supplements and concentrated herbal products with a healthcare professional because interactions can matter. Coconut water creates another important issue. It contains potassium and other electrolytes. That can make it useful in certain situations, but more is not always better. People with kidney disease or certain heart conditions may be advised to monitor potassium or fluid intake. A drink that is healthy for one person can be inappropriate for another. The safest morning habit is therefore not about finding a magic ingredient. It is about supporting the basic habits that protect the vascular system over time. After drinking water, movement may be more important for the legs than the drink itself. The calf muscles act as part of the body's venous pump. When the legs move, muscle contractions help push venous blood upward toward the heart. Sitting still for long periods removes much of that assistance. This does not mean someone should immediately start a strenuous workout. For an older adult who is generally healthy, simple movement can be a practical starting point. Stand up, walk around the room, move from the kitchen to another part of the house. If walking is comfortable, continue for several minutes. The goal is regular movement rather than a dramatic burst of exercise. For people with diagnosed PAD, supervised or structured walking programs can be especially important. Walking may cause discomfort in people with PAD, but appropriately prescribed walking exercise can improve walking ability and quality of life over time. The right program depends on the person's condition and should be discussed with a clinician. Another useful habit is avoiding long uninterrupted periods of sitting. If someone spends hours in a chair, a brief movement break can be simple. Stand safely if possible. Take several steps, move the ankles, change position, then return to the chair. The morning drink and the movement habit work differently. Water supports hydration, muscle activity supports movement of blood through the body and especially helps the return of venous blood from the legs. Neither one is a substitute for treatment of an arterial blockage. Blood pressure is another piece of the picture. High blood pressure can damage blood vessels over time and increases cardiovascular risk. Many people have high blood pressure without feeling anything unusual. That is why regular measurement matters more than trying to judge blood pressure by how the legs feel. Blood sugar also matters. Diabetes can damage blood vessels and nerves and is strongly associated with vascular disease. Keeping blood glucose within the range recommended by a healthcare professional is therefore part of protecting the feet and legs over the long term. Cholesterol matters too. High levels of certain blood lipids contribute to plaque formation inside arteries. When plaque builds up, arteries can become narrower. No morning beverage can simply wash that plaque away. Managing cholesterol through diet, activity, prescribed medication when needed, and regular medical care is a much more meaningful strategy. Smoking is another major factor. Tobacco damages blood vessels and is a significant risk factor for PAD and cardiovascular disease. For someone who smokes, stopping can provide a much larger long-term benefit for circulation than switching from one morning beverage to another. Weight, physical activity, sleep, diet, blood pressure, cholesterol, blood sugar, and tobacco exposure all interact with cardiovascular health. That is why circulation is best viewed as a long-term system rather than a problem solved by one glass. There is also a common mistake worth avoiding. Some people believe that if their feet feel cold, their arteries must be blocked. Cold feet can have many causes. The same is true for swelling, numbness, tingling, and leg discomfort. Symptoms can come from circulation problems, nerve problems, medications, musculoskeletal conditions, temperature, or other causes. Swelling deserves particular attention because it can sometimes reflect a problem involving the veins, heart, kidneys, medications, or other conditions. New or significant swelling should not automatically be treated by drinking more water. The same caution applies to salt. Some homemade drinks add salt because sodium helps retain fluid. But most people do not need to add salt to their morning water, and excessive sodium can raise blood pressure or worsen fluid retention in susceptible people. A simple glass of water is usually a better default than a homemade high-sodium mixture. Sugar is another unnecessary addition. Sweetened beverages can provide substantial calories and sugar without offering a special circulation benefit. For someone managing diabetes or trying to maintain a healthy weight, regularly drinking sugary beverages may work against broader cardiovascular goals. Coffee deserves a more balanced explanation. Moderate coffee consumption can fit into a healthy diet for many people, and research has not established that ordinary coffee drinking automatically harms circulation. But coffee is not a treatment for poor leg blood flow. People who notice palpitations, blood pressure changes, or other symptoms should discuss their caffeine intake with a healthcare professional. Tea can also be part of a healthy diet, especially when unsweetened. Some teas contain plant compounds that have been studied for cardiovascular effects. But again, tea should be viewed as a beverage rather than a vascular treatment. The bigger opportunity comes from what happens after the drink. A person over 60 can use the morning as a checkpoint. Drink an appropriate amount of water. Take prescribed medicines exactly as directed. Eat a balanced breakfast if desired. Move the legs safely. Then continue with normal activity throughout the day. For people taking medications that affect blood pressure or fluid balance, suddenly changing fluid intake can be a problem. Diuretics, for example, can increase urination. Some heart and kidney conditions require fluid restrictions. In those situations, the correct amount of water should come from the person's medical plan rather than an online recommendation. There is another reason older adults should avoid forcing large quantities of water quickly. Excessive water intake can disturb the body's sodium balance. More water is not automatically healthier. Hydration means providing an appropriate amount, not trying to flood the body. The same principle applies to supplements. A product labeled circulation support may contain several herbs or concentrated nutrients. The label can make a dramatic promise, but supplements can interact with prescription medicines and are not automatically safe, because they are natural. If a person has sudden severe leg pain, a leg that becomes unusually pale or blue, a limb that suddenly feels cold, new weakness or numbness, or other sudden changes, that is not a situation for experimenting with drinks at home. Urgent medical assessment may be necessary. Chest pain, severe shortness of breath, fainting, or sudden neurological symptoms also require urgent medical attention rather than a home circulation remedy. For slower symptoms, the approach is different but still important. If walking repeatedly causes calf pain that improves with rest, or if a foot wound is slow to heal, make an appointment with a healthcare professional. Those symptoms can provide clues about vascular health. A clinician may check pulses in the feet, compare blood pressures in the arms and ankles, examine the skin, review medications, and evaluate conditions such as diabetes or cholesterol problems. One test commonly used to assess PAD is the ankle brachial index, which compares blood pressure at the ankle with blood pressure in the arm. That kind of evaluation can answer a question that no beverage can answer: whether blood flow through the leg arteries is actually reduced. The morning glass of water still has a place. It is simple, it is inexpensive. It can help maintain hydration when appropriate, and it can become a useful trigger for another healthy behavior. Drink the water, then move. That combination is more meaningful than searching for a secret ingredient. For an older adult who has spent years sitting for long periods, even building a consistent habit of short movement breaks can be a practical change. The body responds to repeated behavior. One morning does not transform vascular health. Months and years of healthier habits can. A useful morning routine can therefore look surprisingly ordinary. Wake up. Take medications as prescribed. Drink a reasonable amount of water if there is no medical restriction. Eat a nutritious meal if breakfast fits the person's routine. Move safely. Avoid tobacco. Monitor health conditions. Continue normal activity. There is no need for an expensive powder. There is no need for a mysterious recipe. There is no need to believe that a drink can dissolve plaque overnight. The most valuable circulation strategy is usually the least dramatic one. Hydration supports the body's normal systems. Walking trains the muscles and can improve functional capacity. Blood pressure control protects the arteries. Cholesterol management reduces cardiovascular risk. Diabetes management protects blood vessels and nerves. Stopping smoking protects the vascular system. Medical evaluation identifies problems that lifestyle changes alone cannot diagnose. For adults over 60, that distinction can prevent a dangerous delay in treatment. So if the goal is better leg circulation, start with the basics. Plain water can be the morning drink for many people, provided there is no medical reason to restrict fluids. Then, get the legs moving. Keep the habit consistent. Pay attention to persistent symptoms. And when the legs are telling you something has changed, listen to the symptom rather than searching for a miracle beverage. The best drink is not the one that promises to transform circulation in minutes. It is the one that fits safely into a larger plan for cardiovascular health. And for anyone with diagnosed heart, kidney, or vascular disease, the right hydration plan should come from the healthcare professional who knows the full medical history. The glass is simple. The circulation problem may not be.